Hi, my name is Dr. Richard Hilsden, and I wanted to talk to you today about what to expect if you're having hernia surgery. Now, if you're a patient of mine, as I always say, I just want to say thank you. Thank you for choosing me as your surgeon, and I'm excited to work with you to help you get through your hernia surgery. When I'm talking to you in a clinical environment, sometimes it can be hard to have all your questions answered, and in a short period of time, you may hear one thing and not understand the answer. So it's nice to actually have an opportunity to see a video and have some of these questions answered. When you're having hernia surgery, this is essentially day surgery. So you come into the hospital and you're expected to go home the very same day. That process begins with showing up before your surgery and being brought into the day surgery process. So that means coming 2 hours prior to your surgery. There you'll meet a nurse, questions will be asked, you'll have an IV started, and potentially antibiotics will be begun. Then you'll be brought to the operating room where myself and the team will greet you and we'll confirm which side of the operation we're doing. Probably the most important thing that you can do during preparation for hernia surgery is to communicate with us which side you're planning on doing the operating room. Usually while you're awake, I'll examine you and confirm again this is the side and feel the hernia itself. Some patients are tempted actually to shave prior to surgery. Please don't do that actually. The literature tells us that if we trim your hair in the operating room, that's better than you shaving. It decreases the risk of wound infections and various complications. After you come in and you're checked in, you are generally given an anesthetic. We do sometimes do hernia repairs under local, but I prefer in our institution to actually do a general anesthetic. It facilitates speed of the operation and is more comfortable for the patient overall. Then you'll emerge from the anesthesia in the recovery room and then go home the very same day. A few points to remember. The surgical incision itself will be covered by an adhesive bandage that has a pad on it, and occasionally there can be some blood on that pad. That's expected and completely normal. I recommend that you take that pad off 2 days after surgery. So leave it on, and then 2 days after your operation, take it off. Underneath that, you'll notice some steri strips. They're meant to stay on for about a week. Again, they'll fall off on their own, or if they don't in a week, I recommend that you get in the shower and let some water run over that, and then they'll fall off, or you can peel them off in that environment. They're a bit sticky and uncomfortable, so if you just peel them off without moistening them, you might have some discomfort. Underneath that, I sew the skin with an absorbable suture. That will stay in and dissolve on its own. Now, after your hernia surgery, a couple points to remember. I really recommend not lifting more than 20 pounds for the first 3 weeks after surgery. Certainly with a hernia, we don't want to put a lot of strain on the abdominal wall. We want to make sure that you've fully recovered before you're back to those regular activities. After 3 weeks, you can start to return to your regular activities gradually, and I recommend that you don't go from not lifting or not doing exercise to doing your full maximum exercise. I recommend that you slowly move your way up to that point. If you're having discomfort, that's a sign that you should slow things down. I usually see my patients about a month after surgery, again, checking the wound, if there's any pathology for us to discuss, and at that point, usually if there's any concerns that you have, they can be answered. Last thing, patients ask me about pain when it comes to hernia surgery. And it is an operation. And like any surgery, there is going to be discomfort. It's a sharp pain from the incision, but that does get better on its own. And in fact, the literature in our institution says that people don't need anything more than ibuprofen or acetaminophen to take care of their pain. All you need to do is take those over-the-counter medications, and that should be enough. We do prescribe stronger medications. They are available for you, but we only recommend that you fill them if the Tylenol and the Advil or the acetaminophen and ibuprofen aren't doing the trick for you. Again, the majority of patients feel fine with that type of pain medication, but don't expect it to be pain-free. It is a surgical operation. And in fact, we do put some local anesthetic in during the procedure, and frequently patients will feel completely comfortable after their operation, head home, and then when that local anesthetic begins to wear off, start to notice some discomfort. So a recommendation on the day of surgery is actually to take some Tylenol, take some acetaminophen prior to you noticing pain. It's a lot easier to get ahead of the pain and treat it then try to numb the pain after you've had it. If you have any questions at all, my team is more than happy to answer them. Feel free to give our office a call. And once again, my name is Dr. Richard Hilsden, and it's been a pleasure. And I'm hoping that I can provide you good service when it comes to your hernia repair.